All right, it is time for Ask the Derm. Board-certified dermatologist Dr. Billy Groff from Cosmetic Laser Dermatology is here to answer your skin questions. Let's go ahead and get to the first question. My double chin's bothering me. I was considering liposuction, but I heard there's a new injection called Kybella that kills the fat. What do you think, Anna, University City? This is that stuff that was just approved recently, right?
Yeah, it just got approved and we just finally got our hands on it. This product, Kybella, has been in the making for about 9 years. And our practice was very fortunate. We were one of the sites that did the clinical studies that led to the FDA approval. So we, of course, are one of the first to have it available to our patients. It's an excellent treatment. Basically, it takes a very, very little tiny needle and you inject the medication into the double chin area. You can see I have some right here.
Yeah.
If I open up, you'll see it's a clear liquid.
Okay.
So what it does is it breaks down fat. It destroys the fat cells so they're permanently removed.
So how many of those things would you typically use on one person?
Well, it's going to depend, of course, on the size of the area we're treating, but it could be anywhere from a few to several injections. But the needle is very, very tiny. It's the tiniest needle they make, so you barely feel it. We can actually put numbing cream on the area first, so it's an excellent treatment. I think it's going to really revolutionize the treatment of double chin fat.
A lot of folks are excited about that one for sure. Okay, next one. I was guest bartending at a wedding this past weekend, and the next day my hands got really blistered and red. What is this? It really stings. Thomas from Imperial Beach wants to know. Ouch! From bartending?
Wow. Yeah, we see this not uncommonly, especially in the spring and summertime. What happens, these bartenders, they're cutting up a lot of limes, maybe oranges, lemons, and those fruits have a chemical in them which make your hands or your skin very sensitive to sunlight. So if you're out in the sun bartending, the sunlight hits that and it causes a really bad burn, almost like a chemical burn. It's called dermatitis.
Right.
Big medical term, but basically it's just almost like a chemical burn. It can be very serious and go very deep. So it's important if you're bartending outdoors or if you're enjoying, like, say, a beer, a Corona with a lime, if it gets on your skin, you have to wash it off right away or you can end up with some pretty serious burns.
That is serious.
Yeah.
Okay, next one. I'm in my mid-20s and honestly like to show off my body, but I hate all the brown spots that I have on my back. Is there anything I can do? Marco from Encinitas wants to know. Well, these look like freckles, but I guess they're more than freckles, huh?
Yeah, they're basically sun damage or sunspots. So sure, you know, we're again coming up spring, summertime. Everyone wants to, you know, take off their shirts, enjoy the ocean, the pool, what have you. So in a case like this, we usually use a device called Intense Pulse Light, and we can run it over the entire back. And I think we have a before and after. This is a patient that I treated, and this is just one treatment, so you can see a remarkable improvement and diminishment of those brown spots with just one treatment.
And so you have to keep doing this, though, over and over again because they'll come back probably?
Well, once they're removed, now if he had significant sun exposure over the summer, I'm sure some of them would come back, but it would take years to get back to the way he was
How
originally.
much would something like that cost?
To do the upper back would probably be about $500 to $600 for one treatment, yeah.
Okay, next question. The weather's been great, and I've been walking barefoot with my dog at Dog Beach. About a week ago, I noticed a weird rash, and it seems to be getting bigger. Please help. Alex from Ocean Beach. Oh, no. Are we going to see another one of those crazy little creatures
Well,
that you showed us?
again, since we're going into spring and summer, and I talked to Raul about this last year, I think, because I know he likes to walk his dog on the beach at Dog Beach. You got to be very careful because the dogs go potty on the sand, and the owners don't necessarily clean it up. But that has worms in it. They're round worms.
Yeah.
And they can actually penetrate up into your foot and get implanted in your skin and cause that problem.
This is the freaky creature.
Right. That's him. My kids loved it.
We invited this guy back on our show.
That's
it's
right.
terrifying.
Last year, Raul made he tried to imitate the face on this guy, so I'm hoping my kids want to see him do it again at the end of the segment.
I can't get that guy out of my head. I finally just did, and you brought him back. How common is this really, though? I don't know anybody that this has ever happened to.
Well, that's fortunate because, I mean, it's actually fairly common, especially in the warmer regions of the U.S., like the Southwest and California. It probably happens in 1 out of every maybe 5,000.
What'd you say you did for that guy? What do you do?
You have to give an oral medication to kill the worms.
Okay.
Basically, so
you just take a pill and
you take a pill for a couple of weeks, and it just
and then it just dissolves and it goes away.
Yeah, your body will reabsorb dead worm.
You don't see that face ever again?
Hopefully not.
Jeez, Dr. Groff, thank you, I think.
You're welcome.
The information to get in touch with the good doctor is on your screen. He's located in the UTC area. Phone number's on there as well. We've also put a link on our website, fox5sandiego.com. I'm so tempted to ask Raul to impersonate that worm right now.
You don't want that. So I'm so curious. So the picture of that foot, is the worm there, or is that the after what the worm kind of making his way through, or is it still under?
No, he's still in the skin there.
That's the actual worm under.
That's his track where he's crawled. He's probably not filling that whole space, but he's probably taking up at least probably a tenth of that anyway. Yeah, pretty scary stuff.
The face is like this.
There you go.
Do it.
Come on, Raul, you can do it.